Okay, this video is for a suprapubic catheter change with a different catheter. So we're using the open tip catheter, which is for the first time we're using it. And apparently it's got, it's supposed to be better for sediments and all that stuff. Like infections, and I don't know why I said cross infection, but infections. So I've got no mask on because we've got no infection, no offensive smells, no nothing there. And I will double glove up in a minute. I just want to get my kit ready. So obviously this is the opening here of the suprapubic. You see nothing else. Just in case anyone's moaning at me. We are going to get a bit of spasms. I've tried to control it this morning. So what I'm going to do is, I've got everything pre-done here already. I will get a couple of sterilised different gloves. I haven't got my kit ready this morning properly. I'm a bit late for kind of a lot of things today. So here's my sterilised glove, just in case that one doesn't work over there. I've just done a video on the colourless, obviously the catheters, which is kind of weird because, don't you think it's a bit weird? How these catheters, this one is completely different. So I need to draw back, and this doesn't come with a does it come with an empty one? Yes, come with an empty syringe. Sorry, all my syringes are there ready. So use the nozzle. So the next nozzle will probably be different because I think it's got a spigot on it as well. They should all be orange for size 18. They're obviously all colour coded for different catheters.
What?
Okay, it's all right. So I just hold on to it and let it draw back. This has been in situ for just over 10 weeks. So I have 7 there. And I'll just push the nozzle in, draw back again, and make sure you get that whole resistance. If you don't get that resistance, you're not going to get the balloon out inside, which means you're going to cause much trauma. Right? So that is, I always make sure, I don't want that going in my face. That is completely 7.5 mils, which is, that's good. Right, I'll put my rubbish to that side, where my bag and stuff is there. And what I'm going to do now is, obviously with my dirty gloves, everything's prepped there, like I said, but my dirty gloves, I take out the catheter, and then with the new gloves I put in. But what I want to do first is sterilise my hands with a wipe, which is really good to do, especially if you're in a rush or something like that. I mean, you can rush this, but I'm not rushing it. It's so important because it's a different catheter. It's something that I've not used before, and obviously it's the open tip one. It actually has a spigot on the end, so that's pretty cool. And I can touch this because it's still sterilised. As you can see, I've talked in a previous video about this kind of open tip catheter, and it's got two little ports on each side. It will bring out the sediments really much easier than the one that he's got in situ. This I should have done a month ago, 2 months ago was it? But I didn't get around to doing it. So I'll just get my little container there. And there's a segregated area all the way down the catheter, so you don't have to touch it. I'm not putting a bag on it because I'm going to use the spigot. The whole of this area that I've got this in right now is all sterilised, so it doesn't really matter. Then what I'm going to use is, there's two forms of syringes here. So one is got glycerine in, and it's got 5%, which is not this one, which is this one here. And it's pre-filled already. And what this does, is it helps maintain, you know, the balloon where you lose water. It helps maintain that stays in place, apparently. So we're going to figure that one out and find that one out. And then this one is obviously Lanacon, and it's obviously an anaesthetic, and I don't like giving it to anybody, so I'm not going to overuse this because I'm a bit weary of it, but I don't want no adverse effects from it. I've got no open wounds with Ben, so I haven't been able to test it on him, but obviously some of this is going into his body, so I need to figure out if he's going to tolerate it or not. So what I'm going to do first is obviously open up the capsule at the bottom. Put a bit, alright, I'm going to just put a couple of blobs in the tray. Let me see how many mils. I don't need too much. And then I'll pick my spigot up from the spigot and I'll just pop the tip of the catheter in. Remember, it just goes in about this much. Some people use a pen at the bottom so they can guide the next catheter in, but I don't, because I've been using them for too long and I know how far they're to go in. So that's the catheter ready. The rest of this is, I'm going to put 6 mils only, but I might just do a couple of mils inside the actual stoma, because I'm a little bit, like I said, a bit weary, very weary actually. Now Ben's going to take a nice big deep breath. I'm going to open it up there. Remember, dirty hands for this one, it doesn't really matter. And then I'll whip the glove off and put some new gloves on, and we'll insert that catheter in a minute. But I'll put some of the local anaesthetic in, so it gives it time. Are you okay? How's your sats?
All right.
Right, we haven't put the blood pressure on. We haven't done anything because we just want to go by, no noise, just do a quick video on it. So I haven't got any pad here, but I can use this. So I pad there just in case. Yeah, we're going to get a bit of spasm, even though I have massaged the legs. And we've got the catheter. Oh my God.
What? Have you just pulled it out?
It's just absolutely rancid. And now you can see why. That is absolutely disgusting. I've had no foul odours from that. However, Ben's been having kind of issues with it. I don't want to hold you right over there, but if I squeeze that, that's no way. It's all actually not corroded. That's stones in there. The stones blocked out. Look, can you see them coming out? No wonder he's been having a few problems, but we've had to eliminate. And this brown stuff, it's not good. It's infected. So you roll that and roll that to get rid. So that is disgusting. And I can smell it.
Well, I didn't take
from here. So no, that is out.
And the new one's going in.
And the new one is going to go in, if that's okay with you.
Yes.
I'm going to have some sterilised gloves here.
Let's try it.
The first thing I want to do though, Ben, if that's all right, is use this sterile glove that I've got here and actually just put the local anaesthetic in. So I'm just checking my anaesthetic, which is here. And now I'm going to see if it does cause any bladder spasms or trauma, because it states that it doesn't. He's got a bit of blood come out as well, which is like... So if anybody doesn't like blood, get away from this video quick. But there is quite a bit of... There's kind of like trauma there. I'm just waiting for him to take a big breath for me so I can move back. Oh, that's a bit of a clot as well. So remove everything that you can possible. So that's the amount of blood I've got, which is not a lot. It just looks a lot.
I'm not looking.
No, he doesn't like blood. So I'm lifting it up. I'm having a little nose. I should really have a mask on right at this stage because I need to get that blood clot out before I put this in. This is everything on me is sterilised, including the gown. The only thing I should have put back was my hair a bit. I need to get that thick clot out.
Yeah.
You okay?
Mm.
Are you feeling anything?
No.
I need to get that out.
Get what out?
You've got like a clot, so what I'm going to do first is I'm going to use a bit of gauze.
Mm.
And I'm going to see if I can gently get that blood out. That's it, I've got it. So that's the clot I needed to get out. I cannot put anything into that stoma hole. That's beautiful, nice and clean. Without, obviously, clots being removed
Right,
first.
I'm ready for the new one. When you are.
Listen to me. So, I've got 9 mils here. So what I'm going to do is I'm going to open the catheter. And I pop the syringe in the actual stoma. And I have 9. 1, 2,
What are you spraying in?
3, 4,
Just the anaesthetic.
5. Right. They're right. It doesn't cause any spasms.
That's weird, that is.
Absolutely strange. I'll take my glove off so you
Weird
can
that
see.
is.
That is weird.
You're right, I can't feel nothing. That's
So,
weird.
let's see.
I can't feel nothing.
I don't think you can feel anything, can you?
No, I can't.
There's the dog.
Normally I can feel it.
Right. I just want to show you. The blood, ignore the blood, but I want to show you. No trauma. But it can't, look, there's no bladder spasm. It's beautiful. No urine coming out. That is beautiful. Absolutely beautiful. Apart from it needs cleaning, which it looks like I'm going to have to clean that through.
You're sticking the new one in now.
Yeah, but that is brilliant, that is. That is absolutely beautiful.
It's going to work.
I just want to grab some saline.
No, don't. Just carry on.
Do you want me to just carry on?
Carry on, just do it.
Right. Listen.
I don't want to get up. I don't want to be in this bed anymore.
He doesn't want to be in the bed no more, and I don't blame him.
No.
So all I'm going to do here is put a sterilised glove on. And then, so what holds the balloon up is only 6 mils, 5% glycerine. The rest is obviously water. I only need 1 sterilised glove. The other hand needs to be a bit dirty, but maybe I'll just put another one on just for safety. Normally, when he's got an infection, I will have a mask on. I will have, I'll have extra aprons on. Oh God, here we go. It's because I haven't double gloved.
Yeah, I can take my stats off.
With 2,
95,
1 medium and 2
55.
larges. That's what I normally put on. 95, 96%.
No,
So I'm hoping
55.
when I get my elbow down and pop this catheter in now, I'm hoping, and I'll show you, I'm hoping no spasms, no nothing.
I should
So
urinate
I
straight
can
away.
now touch this because I'm hands-free. I've also got here, which is another sterilised glove, and I'm going to pull the whole of this because I can, because it's all sterilised. I am going to just make sure that I've got enough lubricant. So basically the catheter goes in about that much, okay? I always, you'll feel it yourself if you were doing it, but I will show you.
You go, love.
So you bring, actually I was going to say bring the tray, but I don't have to because we have a spigot on the end, which is brilliant because the urine's not going to go anywhere. So they made these catheters pretty cool. So it's lift up, ask Ben to take a breath. Take a breath out. And flipping on, here we go.
What?
Okay.
What?
Nothing. Not gonna get this in. Yep, it's in. But let me just give it a sec. That is in situ. That was absolutely easy.
Right, I had a little bit of AD.
I did not have no spasms.
Not much.
How much AD did you get?
Hardly any.
No, that blood was from the last. I believe he's got some sort of underlining, like probably a little clot inside that we need to get out with what I've seen that disgusting stuff come out.
I'm blowing the bag up.
This is kind of unique because I'm waiting for urine to come out to make sure I've got it in situ. So the other way to make sure you got it in situ before you blow anything up is just get your 2 fingers and give it a little.
What?
Not with this one. Okay, the other ones, you could give it a little wiggle and it stayed in situ. It's kind of your body sucks it in.
And what's this one doing?
This one is, I'm just making sure it's in situ with my fingers. By the way, I've been dealing with catheters for, what, 20 odd years, 27, probably 28
This
years.
one feels weird, by the way.
This one, how does it feel?
Different.
Before I blow that balloon up, do you want this catheter still? Do you want to test it? It's going to feel weird because I need to glove off.
Is it in situ? Blow
It's
it
in
up.
situ, I haven't blown it up. You want me to blow it up?
Blow it up for now.
Okay.
I just want to know if it drains and if it does.
Obviously, this is a pre-filled syringe that comes with all these catheters. And like I said, the last video I've done is not very good because the glycerine in the
I
wine,
don't feel bad.
or the the anaesthetic is not. It looks off.
Have you got, what is it,
So
glycerine?
this is what is in there. It's 5% glycerine. Now, what happens with this 5% glycerine, if you read it, apparently it holds the balloon in place and it doesn't allow escapage of fluid. So we'll find out.
We'll soon know.
We will soon know. So that's in situ.
She's blowing it up.
I'm going to blow it up. Don't let go of the end, because if you let go of the end, it comes back out. So you have to push it in and actually cap off. So there's no fluid left in there. Otherwise, you're in trouble.
Right, I'm going into AD now.
You're going to go into AD a bit because do you know what? You've got not backflow. I need to glove off.
I mean, piss is coming out.
I need to make sure the urine's going to come out now.
I think that's what's happening.
Okay, so what I'm going to do is release that spigot, get some new gloves on, release that spigot and get a bag attached to it and to see if it works. How do you feel?
I feel fine.
100% fine?
That was the best catheter change ever.
Get lost. No way.
Honestly, it was.
What?
I had no pain.
Right, you have no pain on the simple reason is of the anaesthetic. It's because doctors and surgeons don't allow us to have it really, but they give it me because we've had that many problems with you and that many issues.
Yeah, well, perhaps this is going to work a better thing. Perhaps I won't have to have many.
You're the person that would be an advocate for
I know.
somebody.
Perhaps I won't have to have many bladder washes and all this. I won't need it.
Exactly. Exactly my whole point for that.
They should have given you this in the beginning.
Listen, I've been fighting for different catheters for absolute years. I've had to fight the NHS basically just to get him into hospital for a different catheter, which I could have done at home. But you know what? It took a lot of arguments and a lot of moaning and a lot of... Yeah, I had to slag the NHS off before we got what we got. And we had to go to 4 different hospitals to actually get that because there's nothing really in England.
Yeah, here comes the AD.
For spinal. You're going to get AD because what I'm going to do
Spigot off.
is he's not used to a spigot,
No.
which means a cap off, which is that. But I don't have any urine flow at the moment, so I'm going to figure this out. Oh, I do now. Oh, and I've got some nice big fat lumps. So, always, I try and show the camera, always see what you get first out of your catheter. I mean, sometimes I always put a bag straight on it.
That's what I mean. I know when I'm in AD.
No AD? You shouldn't have
No
AD
AD.
now because it's gone. So you always move all that out of the way and always have a swab to put over the top. And then afterwards, my suggestion for everybody, right, is always clean your catheter. I believe that this is beautiful, warm to touch. It's perfect.
Of course it is.
I can't put that gauze in there, but what I can do is give it a wipe and have a check to see how much trauma did happen, which I don't think any.
Hardly any.
I'm just taking away the old blood and the blood clot that you had come out with that catheter. For some reason, a clot. Now, I believe you're going to feel better if you don't already. How do you feel about that?
That's all fine.
Was that an easy... See, like I said, we don't normally have blood. We don't normally get blood, all right? I don't get blood. But this time I've got blood because Ben's been suffering on his left side. This is just a tick.
I have still got a bit of bloatness.
Yeah, but you've only just had a change, mate.
Here you go, love.
Hang on.
I
What
won't
are
need
your
that.
sats?
I'll have a look now. Now that you've done that.
What are your sats coming up as?
I ain't got my
Make
thing.
sure everything is sterile before you ever go into touching these, because if that goes into the body, antibiotics still all, isn't it? And nobody wants to have antibiotics all the time because they actually just get used to the body and then they don't just give up and don't work. So this is working perfect.
Yeah, it would.
I will put a complaint in against, obviously, giving me faulty equipment again. We must be one of the most moaners in Britain for actual medical supplies.
Is that bad, 48?
Medical stuff. No, that's your heart rate.
Oh. 96,
96 over
96, 51.
60 or 51?
54.
So yeah, all his vital signs are right. I'll do a BP in a minute. I should have done the BP
No, don't do a
previous,
BP.
but
You don't need to do
he
one.
just wants to get up, get in the bathroom and have his shower. I always do it pre-shower because obviously it's a dirty job. And sometimes we're supposed to shave beforehand, but I'm not going to do that. So he is perfect. Sterilise all your kit down afterwards, and that's fine. And it's
You've got the new
running
catheter.
beautiful. And it's not even, no blood, no nothing present. But let's see what happens with this, because this is kind of interesting.
It's an
And
experiment.
now I'll show you. Yeah, it's an experiment. And we experiment everything in this country because it's that disgusting with some of the stuff faulty. I don't care how long the video takes because it's a video that
I won't be able to send you that video.
to give
either.
you an awareness video. No, I can upload it somewhere. I'm not really bothered.
No, you won't, because you've got no menu on your phone.
I know. You're going to change my phone, aren't you? Because it's broke.
Yeah.
So we're going to try this catheter and see how it goes. I will take you around and show you what it's... Well, I don't need to take you around and show you what it's like. There it is. But there again, if I lift it up, it's even better for you, so... But it is a messy job. A bit of a messy job sometimes. Especially when we've just done a brand spanking new one. Oh, I can't get there.
Felt weird to start with.
Did it feel weird?
Yeah, but now it's fine.
So it's absolutely peachy perfect, that is. And you've got all the urine coming straight out, which is nice. And then the rubbish to clean up.